I am Dr. Kamil Rechache. I'm an attending physician in the Division of Stem Cell Transplantation and Cellular Immunotherapy at MedStar Georgetown University Hospital. I take care of patients with blood cancers who are in need of stem cell transplant or cellular immunotherapies. The most common question that I get from patients is, why am I here? What is the process of stem cell transplant or cellular immunotherapy, and what does that entail? What I love the most about my job is the privilege of being able to take care of patients who are often at their most vulnerable times in their lives and being able to offer them hope when they feel hopeless. My philosophy of care is centered on providing compassionate, personalized, and evidence-based treatment options to patients who are often facing complex and life-altering diagnoses. I am committed to providing them clear and transparent communication so that patients feel informed but also empowered to make decisions that align with their values and their goals of care. Autologous stem cell transplantation is a multi-step process where we provide and treat patients with high doses of chemotherapy with the hopes of curing them of their blood cancer, but also subsequently rescuing them with their own autologous stem cells. Autologous in this scenario means that they are from their own body, as opposed to allogeneic, which is when we use stem cells that are from others. So what patients can expect with the process of autologous stem cell transplantation is a multi-step process that first starts with meeting with our multidisciplinary team, which includes physicians, social workers, registered nurses, dietitians, nutritionists, and pharmacists, to really evaluate the patient and their disease status. Subsequently, they undergo evaluations to evaluate the status of their organ function, their disease status, to ensure that it is in a state that would be compatible with the stem cell transplant process, and subsequent multiple visits where we walk the patient through every step of the process and subsequently admit them to the hospital and then follow them as an outpatient to ensure that they've fully recovered from the process. So during the stem cell collection process, patients should expect to be in the hospital for several hours, sometimes several days, 2 to 3 days. We try to collect as quickly as possible. During that process, they are evaluated by nurses and physicians and are connected to a machine that separates the stem cells from the rest of the cells in their body to ensure that we have good quality control and the right amount of cells that are needed for the stem cell process. So there are two different methods of a collection for stem cell transplant. The first is autologous, which means that the stem cells are collected from your own body and then subsequently stored and reinfused after the chemotherapy process. The other option is an allogeneic stem cell transplant, where the stem cells are collected from a donor, whether nationally or internationally, sometimes even related, and subsequently stored and then infused again after the chemotherapy process. What patients can expect after their autologous transplant process is subsequent visits in our clinic weekly up to a month after the transplant, where we evaluate their blood counts and their immune reconstitution to ensure that they have adequately recovered from the stem cell process. We meet again with a multidisciplinary team to ensure that all aspects of their care are being addressed. And subsequently, at about 3 months after the transplant process is when we begin the immunization process to ensure that they have fully recovered and are ready to get out into the real world. So an allogeneic stem cell transplantation is a process where stem cells are collected from a donor that can be either related or unrelated, and that those stem cells are subsequently collected and stored and given after the process of chemotherapy. The hope with an allogeneic stem cell transplant is that those new stem cells and immune system would be able to control and subsequently cure you of the blood cancer that you are suffering from. Allogeneic stem cell transplantation is most commonly for patients suffering of blood cancers, where the hope is that the new stem cells and immune system would be able to control and ultimately cure them of their blood cancer. However, this is not only limited to patients with blood cancers and can include non-malignant diseases such as sickle cell and other non-malignant diseases such as inborn errors of immunity. So the matching process with a donor is a multi-step process. The first step is ensuring what type of HLA, which is a marker that is present on stem cells in the immune system. This can be collected either through a cheek swab or through a blood test. Subsequently, this is sent to the lab where they type out the specifics of your immune system. This is then matched with either a related or unrelated donor through a national registry that's called the National Marrow Donation Program, formerly known as Be the Match. And the biggest advance in our field currently is that we no longer require full matches to perform stem cell transplants and can even perform stem cell transplants for patients who are at even a half match. CAR T therapy stands for chimeric antigen receptor therapy. That process involves collecting a patient's own immune cells, specifically their T cells, which are subsequently sent to a lab where they are modified and genetically engineered to recognize specific markers that are present on cancer cells to hopefully and ultimately harness the patient's own immune system to cure them of their condition and disease. So most patients are actually eligible for CAR T therapy, which has really allowed us to expand this therapy to patients with a wide variety of blood cancers, including young but also old patients. The benefits of CAR T therapy are twofold. One, harnessing the patient's own immune system, which can be powerful in ultimately curing them of their blood cancer, but also minimizing toxicities as compared to more traditional methods of treatments such as chemotherapy. So some of the advancements that I've seen over the past 10 years in stem cell transplant and cellular immunotherapy include the ability to offer stem cell transplantation for patients who do not have fully matched donors in the registry. This has really allowed us to provide this life-saving therapy to the majority of patients suffering from blood cancers. One of the aspects that I'm most excited for and about in stem cell therapy currently is the ability to potentially use what are called off-the-shelf CAR T therapies, where these T cells are collected from donors ahead of time to be then able to be given to the patient as soon as they are requiring it to hopefully cure them from their blood cancer.